Good evening, and thank you so much. Here I'm going to go ahead and hit continue to start my recording. Welcome, everybody. I'm so excited this evening to have you all in attendance and share in this celebration and of a successful launch of our heart program here at Stanford Health Care ValleyCare. We started this program back in June of 2020 with our Stanford faculty, and achieved a milestone of 100 major heart surgeries in less than a year. Just a wonderful accomplishment, a tribute to all of you, to the team here that we're going to recognize, to the leadership that really made it happen, and obviously a great gift to the community here in the Tri-Valley. So really excited to bring us all together and really share in that moment. We have a wonderful line of speakers set up here this evening to really kick off the celebration and to help contribute their thoughts and their appreciation to all those folks that are involved. I'm also very excited. We have one of our own heart patients here this evening joining. He's on the call today, and so we'll be talking to him a little bit later in the hour to kind of hear about his experience and patient experience here at Stanford Health Care ValleyCare. So really excited about that portion. And then, of course, just an overall celebration and recognition of all the team members and staff involved in the heart program. So without further ado, I'm going to go ahead and start by announcing our first speaker of the evening, Rick Shumway, who's our president and CEO of Stanford Health Care ValleyCare. Rick.
There we go. Mino, can you hear us okay? Perfect. So welcome, everybody. I'm just thrilled to be here. This is great. It's also great that we kind of get to do it in person a little bit. For those of you who are virtual, you're missing out. We have balloons and cake and so forth, and you could have partaken if you were here, but that's okay. We're really excited to be with you all tonight. I just have to say, I am so excited about what this represents for our organization, but more importantly for the community that we serve, every single day. As I was thinking about this particular milestone that we've accomplished in such a short period of time, I have to say the first thing that I thought about is this is exactly where we hoped that we would be. And what I mean by that is when you look backwards in time, there were a few things that had to be put into place to get us to this point. When you look at Stanford medicine broadly, there's a very deliberate and integrated strategic plan that essentially outlines what Stanford medicine is going to do over the course of 5 years or so. Underneath that integrated strategic plan, there are a variety of other strategic plans. One of the strategic plans is the Cardiovascular Health strategic plan for the whole system, and the other one is the Stanford ValleyCare strategic plan. What is so exciting about this is that in every single one of those strategic plans, this has been identified as one of the top priorities for build and development here in our region. And so predating the amazing work that the teams have actually done to do this, I just want to say that the organization is 100% committed to and behind not only this program and this initiative, but broadly the service line. This is reflective of, again, what we had hoped to accomplish. What I will say, however, even though this was on a roadmap somewhere, the outcome has been even more than I could have hoped or imagined in the period of time that we've been able to accomplish it. And that is due to the people that are in this room, and it's not John and I, but it's also the people that are in the room next to us, and those of you that have joined us virtually. We'll see some great pictures and otherwise, but this is really a credit to all of you, the teams that have made this happen. And the last thing that I'll just say is this is a moment in time. The outcome of what this is going to look like over the course of the next year, 3 years, 5 years, and beyond, I think we're going to look back and we're going to remember what an awesome thing this was to get to 100. But it's also going to look even dramatically different than it does today. And again, I can't say enough. I'm just so proud of everybody and so thankful on behalf of the community and on behalf of the organization I just have to say we're so grateful for the amazing work that's been done by Dr. Longoria, Dr. Currie, and the teams to make this work. I would also be remiss if I didn't say thank you to Dr. Wu, who is 100% supportive of the growth and development of the heart surgery program here. And I know we'll hear from him in just a minute. So I know he likes to be thanked publicly. So yeah, I'm sure he'll be happy about that. So anyway, thank you. I'm going to turn it over to John for a few words as well. But from the bottom of my heart, no pun intended, legitimately, we're so grateful for how this has evolved. So,
well, thanks, Rick. There's not a lot to add, but of course I will. On behalf of the directors and the entire board, we're so excited. Recognizing a milestone like this validates the need in the community. It also identifies a large number of people that have been helped in our community. And I know your referral patterns are going to show a lot bigger than our community, but our community had a need, and you don't want to do a little bit of anything. And everybody in this organization wakes up every day thinking about quality and patient safety. And quality and patient safety in this line, as with anything, depends on volume. You have to do it. You have to have processes. You have to have professionals. They need repetition. They need to stay fresh. And I couldn't be more thrilled with what's happened. And to start it off in the middle of a pandemic, I don't know who put that in the business plan, but I would not have. Just really, really happy to have you here. So on behalf of the board of directors and the community that we represent, I just want to say thank you to the two of you. Congratulations to the entire team. Very, very proud of the work that you've done.
Thank you.
great.
Thanks.
Great. Thank you, John. Thank you, Rick, for those great opening words. Really appreciate you both being here and supporting us. I'd like to now announce, I have the privilege of announcing Dr. Joseph Wu. Joe Wu is the professor and chair of the Department of Cardiothoracic Surgery at the Stanford University School of Medicine. Dr. Wu.
Mino, thank you for that introduction. And I will just comment that you forgot to mention that I am the Shumway chair of cardiothoracic surgery, and that in fact, Norman Shumway and Rick Shumway are somehow very distantly related. So we knew that this was destiny. It's been a long journey. Since I would say around 2014 to 2015, we've been thinking about should Stanford, can Stanford, and will Stanford ultimately be intricately involved in providing cardiovascular care to patients at ValleyCare in Pleasanton. And over the many years, we've worked with a variety of people and made it to this landmark event. But we would not be here without Rick Shumway and John Sensiba. They've done so many things behind the scenes in getting us to this point that they'll never take credit for, but I think we really need to thank them for their leadership and their vision in seeing the opportunity and the tripartite mission and the relationship with Stanford. And I thank you for your partnership in helping me with everything that we've been doing here. We also have to thank several people here at the main campus. Of course, David Entwistle for being supportive overall of everything we're doing, and Sri Sasadri and his operations team with Charlene Kell and Megan Attashru, who really have led the sort of day-to-day ramp up together with all the people at Pleasanton for our service line and our program. I also can't fail to mention David Speck, who's been a tremendous partner from when we first started having issues with credentialing, all the way up to even a discussion today about extending the multi-pillar aspect of academic medicine out to ValleyCare and looking into the possibility of bringing our first cardiothoracic surgery resident out to Pleasanton. So David, thank you very much for your extremely valuable partnership, and I look forward to working with you hand in hand on not only building this aspect, but then the research mission next. I think I want to just spend a moment introducing Jim Longoria and Maria Currie, our two surgeons there. When you build a new program, it's all about the people. So the people there and then the people that you're going to bring in. And when I thought of how to try to build a highly productive cardiac surgery program at ValleyCare, I thought the most important thing is to bring in a very seasoned, experienced, comfortable, and confident high volume surgeon. And out in California, and mostly the West Coast, because of the fractionation of cardiac surgery programs, there are not as high volume programs and surgeons as you would see on the East Coast where I come from. But Jim Longoria was one of the highest volume heart surgeons on the entire West Coast. And Jim and I were friends before and had sort of kept in touch. And when this opportunity came up, we sort of talked and said, Jim, would you ever think about coming down to ValleyCare? And immediately said, that's a great area. I know there's great people there. And, I'd love to take a look at this. And I think from the first moment that he stepped foot there, everyone at ValleyCare was just absolutely welcoming of Jim Longoria. And, Jim has helped lead this program to an all new level. I think the cadence, the pace of operations there is perhaps the highest that it's ever been at ValleyCare. And the complexity is also escalating. And I would here introduce Maria Currie, who comes to us originally from Canada, but trained with us here at Stanford and did a fellowship in complex transplantation and artificial heart devices. And was very comfortable doing all sorts of ridiculous operations here at the main campus. And I remember speaking with Maria and saying, would you be interested in helping us build one of our programs outside of Palo Alto? And she was very happy to. So I think Maria brings another dimension also that I'm sure David Speck will be exploring together with Rick Shumway as time goes along on adding mechanical circulatory support and building an ECMO program out there, really just taking it to a whole nother level. Now, beyond just their capabilities is their partnership and their collaboration and their synergy. These two individuals work so well together. They communicate about every single patient. And to that end, I think every single cardiovascular surgical patient there is having the benefit of not just one mind, but two minds and four hands. And so I think that's a particular strength out at ValleyCare. I would also say that we have one other faculty surgeon out there, Doug Louie, who actually started out there before Jim and Maria to build our thoracic program. And he absolutely loves it out there. He and his family live nearby. And when this opportunity came up, he immediately jumped on this and said, I'd love to work close to home and do something more for the East Bay. So we have that team there together with our vascular surgery team. And that's a cadre of individuals that I think can deliver a really high level of care. I think the last two things I want to mention are no cardiac surgery program exists without the support and the partnership of cardiologists. And I will just briefly tell you a story that is kind of funny, but cardiologists rank about as high as you can possibly imagine in our spectrum. And I can tell you that I've walked out on the dean to answer a call from a cardiologist, and I've actually walked out on the university president to go answer a call from a cardiologist. And both times I went back apologizing, and they said, no, you need to pick up a phone when the cardiologist calls. So I want to thank all of our cardiology colleagues, and you'll hear more from them. And then lastly, and most importantly, I think it's just vital that we thank the patients and the community for entrusting us with your care. And we are absolutely committed to delivering the very best care to you and to your families. We promise to do that. Thank you.
Thank you, Dr. Wu, for those great words. And I personally want to thank you for bringing Dr. Longoria and Dr. Currie over to ValleyCare. You've certainly made my job a lot easier, so appreciate that. So on that note, you've heard him announce her a little bit. I'd like to introduce one of our cardiothoracic surgeons. Let me get my, there you go, Dr. Maria Currie.
Thank you for that introduction. I'm so proud to be part of the ValleyCare cardiac surgery team. And I'm so happy to be here to celebrate this great milestone. I think over the past few months, we've made great strides in our ability to provide cutting-edge cardiac surgery care to our community. Namely, we're providing minimally invasive arrhythmia surgery, providing mechanical circulatory support, and that's just to name a few. So none of those accomplishments would be possible without a stellar, hardworking team. So thank you so much for that. But as proud as I am of these accomplishments, I think this is just the beginning. We all know that we still have far to go. We have ambitious plans to work more closely with our cardiology colleagues to expand our referral base and to start providing transcatheter valve procedures as well. Those are just, first steps. So thank you so much for working with us to grow this expanding team. And I think we all expect to reach our 200th patient in an even shorter period of time. Thank you so much for your hard work, your ingenuity, your ability to adapt and learn. And most importantly, thank you so much for your dedication to cardiac surgery patient care in our community. And congratulations.
Great. Thank you, Dr. Currie. I love the ambition. Certainly looking forward to number 200. We'll now introduce our other cardiothoracic surgeon, Dr. James Longoria. Dr. Longoria?
Hi, everyone. Thanks for joining us. So, again, just want to thank everyone that's on the call and everyone who will probably view it later. I always say that heart surgery is the ultimate team sport. It requires everyone that's involved, that is involved with the patient. It's a memorable event for the patient. I think that's the thing that really struck me when I did come here and interview, is as soon as I walked through the door, I was made to feel welcomed and made to feel that the day was special for me. And I hope that's the kind of the values that we espouse to our patients, and I hope that's the experience that they get as well. Before we thank all of the individual team members and things, and before we go over some milestones, we do need to thank Rick Shumway, Dr. Wu, and John Sensiba, because without vision, there is no program. And that's what really struck me as well, is that the opportunity was here for growth to serve the local community, but the vision and the plan, as you said before, was laid out and it was already set there. It was just a matter of execution. And so, that's what Dr. Currie and I have chosen to do, and it appears so far that we're going according to plan and exceeding plan, and it's working out very well. So I think one of the things we can do is let's talk about some of the things that we've accomplished in a very short period of time. And then you guys can see that here. On June 1, we did the first operation, which was done by a Stanford surgeon, and that was by Dr. Jack Boyd. And Dr. Wu had said, on June 1, when we take over the program, we better be operating. And sure enough, there was an operation scheduled that day. And so the thoracoscopic maze, which is a beating heart epicardial operation for patients that have atrial fibrillation. The first one ever done at this hospital was July 7th. Dr. Currie implanted the first Impella 5.0, it's called 5.0, percutaneous left ventricular assist device through the axillary artery up here. That was done in March of this year. And she then followed that up because she wanted to outdo me and outdo herself by putting in an Impella 5.5, which is the latest, greatest device. And I will say, believe it's the second patient that came all the way from Portland to get that done here. And as you guys know, we surpassed 100 major cardiac surgeries on April 12th, 2021. It's just the beginning of a great journey for all of us. Talking about where the patients have come from, we wanted to serve the Tri-Valley area because there was a significant need in the area, and that's what we've done locally. But we have expanded, word has gotten out. You can see on the heat map, as we call it, of California, there all the dots are where the patients have come from, even as far as Southern California. We've had a referral from a patient over in Virginia. And again, the one up in Portland was the patient that Dr. Currie put the 5.5 Impella 5.5 in. And so we're just expanding, in all areas, but we truly see the need here in the Tri-Valley area and the surrounding areas. And you can see that our referral pattern has extended eastward out into the San Joaquin Valley, but specifically we want to grow as well in the East Bay. And as Dr. Wu has said, we want it to be an extension of Palo Alto, meaning ultimately we'd like to provide all of the services of cardiac surgery that we can provide safely, effectively, and such a high level, probably except for heart transplant. And that's our goal. So when Dr. Currie said we have ambitious goals, we have ambition to really serve up a first-class, high-quality, world-class heart surgery program, which is an extension of Palo Alto main campus. So with that, Mino, I'll give it back to you, I think.
Great. Thank you, Dr. Longoria. Dr. Currie, appreciate the opening there. I'm actually really excited to continue the event and really highlight our next part of the agenda. We have one of our own heart patients here and really willing to share his experience and his story with us. Gary Taverett, can you hear us? You're on mute there.
There we go. How's that?
Perfect. Thank you. First of all, let me personally thank you for attending our celebration this evening, being a part of it, and also willing to kind of share your experience, your story with all of us. I'm sure the care team that was involved in your care will be happy to hear, as well as all of us. And so thank you for being here. Just a little bit about Gary. Gary is located right out of Roseville, California, right outside of Sacramento for many of you guys that know the area here. He's currently working in the packaging sales industry as his occupation. And back in December of 2020, Gary was actually referred to our CT surgery group by his cardiologist, Dr. Stephen Peters. He also mentioned to us he actually had his first heart surgery done about 17 years ago when he had an ascending aortic aneurysm. And it was that aneurysm that actually made his aortic valve unsalvageable. So Gary, first of all, once again, thank you for being here. Thank you for willing to participate, share a little bit about your experience. And so I guess the first question, and in your own words, why don't you tell us about, the care that you received here at Stanford Health Care ValleyCare?
Thank you very much for having me, everybody. I am enjoying actually the presentation and learning more about the Stanford program. I've heard the word grateful a lot. I think there's nobody more grateful on this call than I am for being part of your program, because my surgery was on February 9th, and I was really looking forward to seeing February 10th. And that was a great day in my book. That was my goal. And your team from Dr. Longoria, Dr. Currie, Sarah, Shane, Liz, everybody that I interacted with were just phenomenal. They treated me very professionally. They were very explanatory on everything that I was going to be going through, and every question I had was basically answered. I mean, it was well orchestrated, well run, and I was never really that nervous until the day of. And even that day, I kind of knew that I was going to come out just fine. Nothing was going to be as bad as that first one. And like I said, I'm very grateful. Really am.
Thank you, Gary. And then in terms of, all of the communication pre and post surgery with you, the interactions with the staff, with you, with your wife, with your family, anything to share around that? Were you happy with that?
Yes, my wife was, she was waiting outside, and Sarah called several times during the surgery, kind of gave her updates. And then Dr. Longoria met her afterwards and told her how it went. It was just, top-notch care for everything. And then when I was recovering for those few days I was in the hospital, I saw the team at least once a day and sometimes twice a day come by, ask me questions, see how things were going, if I needed anything. I didn't need anything. Even the nursing staff that was there, they did a great job. I mean, I had everything taken care of. I was really happy, really happy.
Wonderful. Last question, how has this heart surgery changed your life?
Well, I hopefully get another 17 plus years out of this particular valve, and then going forward, I'll have the TAVRs done. My blood pressure's dropped 25, 30 points because of this. I mean, not that it was horrible to begin with, but I am right in the normal range right now. I'm looking forward to, getting back my full range of activities. I'm taking it slow, like I've been told to, and like I said, I'm just really, really grateful. Everything is going really well, really well.
Great. Well, thank you, Gary. I once again, just greatly appreciate you willing to come out and spend some time with us and share that story. Please stay on for the rest of the celebration. I'm so happy that you recovered well. You're doing well. You look great. So thank you again. I know the care team and everybody here are happy to hear that. So
yes, thank you for having me. I appreciate it.
All right. Well, I'm going to pass it back over to our surgeons to do what they wanted to do, and that is really to say thank you to the entire team. So Dr. Longoria, Dr. Currie.
Want me to start? I'll start. Well, Mr. Tavright, first of all, take it for a test drive. That's what I want to tell you. You're out there. If it feels comfortable, go ahead and do it. That's the whole point of what you went through. And thank you again for entrusting me with your care. I mean, it goes without saying that, you just can't do it all by yourself, and we don't. And, we want to point out some particular people, particularly the staff that are involved. You heard some of the names from Mr. Tavright. You can see the names here. It starts off from preoperative evaluation, the clinic visit, the phone call, all of those things. We just can't say enough. It starts there. The patient's journey starts there. I want to thank everyone. I could read off all the names, but you can see them. All of you know who you are, because hopefully Dr. Currie and I say thank you enough in our daily interactions with you. If you want to go to the next slide there, I think is the heart team in the OR. And I think one of the things that all of you know, and I've told you this, that the operating room is, for myself, my sanctuary. As intense as things are, it allows everyone in the room to focus on the task at hand. And we work collaboratively, and we're excluded from everything else. And it truly is a sanctuary from all of the things that are going on in the rest of the hospital. And I can't thank all of you enough. And, that it's just been a spectacular experience to work with such dedicated, hardworking people. And, when we all set our minds to doing something great, and great things happen. So it's not just the OR team, it's the ICU team as well. I will tell you guys this. I think when I looked at the roster, I think we did patient number 138 or something like that today. And all of you need to be proud of yourselves as well, for all of you in the ICU, because you've touched those patients, and your care afterward has been incredible. And the next thing that we're looking forward to is our next service line, which is the opening of the future AAU. Some of you have had the opportunity to come join us in the operating room and see how things affect you down the road. But we're looking forward to transitioning our patients over to your care as well. And just, I want to remind everybody that as long as we all think of ourselves as being extremely important to the patient in terms of their interaction and their care, that patient is going to do well. And I think that's the whole future that we have looking forward in terms of these things. I'd like to ask Dr. Currie to kind of say a few things as well with regard to our future, since she's a lot younger than I am. So.
Thank you, Dr. Longoria. So as Dr. Longoria said, cardiac surgery is the ultimate team sport, and none of this would have been possible without the entire team and the hard work and drive and ingenuity, I think, in starting up and really expanding this program. So I think, as I mentioned before, as great as it is now, I think going forward, we just need more of that. So we'll be expanding the teams, expanding our presence, I think, in the hospital with the AAU. And so it's really fantastic to be part of this growing team, an ambitious team that wants to pursue, even higher goals. So I really look forward to being with you all. through that growth. Thank you.
All right, thank you, everybody. And on behalf of, the surgeons who just said it, I also thank all of the team members involved this past year to make this such a successful program. I did want to close out with kind of a what's next. So it doesn't just stop here, right? We're not stopping with this milestone celebration. We've got a number of things that will continue to effectively enhance and this community around all of our cardiovascular program and the heart program. A few things on the horizon. You heard about the AAU. That's planning to go live in June of this year. So congratulations to Monica, Tina Cartwright, that whole team in getting that team ready for just the next step in evolution of this program. We've been joking, we wanted this celebration to be in person and a great, kind of more of a livelier celebration, but we are going to have that. We're committed to having a big ribbon cutting ceremony, hopefully at the end of the year when we can get back in person and really celebrate with the community the opening of our Heart and Vascular Center. That's going to open up at the end of this calendar year. So really, really excited about that major accomplishment and milestone. And I'm sure we'll have everybody here again for a much more livelier and a celebratory occasion. We're doing things where we're increasing, we're looking at programmatic evaluations with EP and TAVR and looking to get that started pretty soon. And then most importantly, infrastructure-wise, we got a major project underway where we'll be upgrading 3 cath labs. And the first of those cath labs will go live at the end of 2022. So we're looking at the end of 2022 for the first of 3 optimized cath labs, with the next 2 in 2023 and 2024. So really exciting things for the cardiovascular program. We continue to look forward to celebrating those major milestones. So thank you, everybody, again, for your attendance today. Really want to thank the speakers, Rick, John, Dr. Wu, Dr. Longoria, Dr. Currie. Thank you to all the care teams, the ICU, the OR, and obviously the future AAU team for everything that you guys do. We're really excited and we continue to look forward to celebrating more events. So I'm going to now ask anybody to please raise your hand, put a question in the chat, and I'm going to stop sharing here so we can open it up for Q&A. All right. We've got a number of nice congratulations here. Feel free to do a hand raise in the
Sure. I can
chat
start. This is Ram Pradang. I'm the department chief for cardiology and the medical director for cardiology services here. I just want to take a few minutes and thank everybody for kind of building ValleyCare to where it is now. I think this is a great night, to acknowledge this, but this is just a start for us. I've been here for 11 years now, and this honestly is the most excited I've been about this hospital in this area in ever. I think what's happened in the cardiovascular space has really been a testament to not only ValleyCare, but Stanford's commitment to the area. And I thank David Entwistle and Rick Shumway and John Sensiba and many others for that on many fronts. And I think Dr. Wu, I think you were very perceptive in being able to recruit Jim Longoria and Maria Currie here. I think that was a great victory for us. And I think there's no one that really acknowledges otherwise now. I mean, when you look at when you said the who matters, the skill matters, having the vision matters, and all those are important, and just as importantly is having this collaborative spirit. And in every case I've been involved with, both Jim and Maria, I can't think of a single day where I've not touched base with them 2 or 3 times about these patients. So I really feel they value our opinions. I really feel that this really is a team-centered and team-centric approach. I think Stanford's partnership we've seen it already. The infrastructure is coming, the programmatic growth is coming. Jim mentioned the AAU. We're talking about TAVRs and EPs. These are things that we never mentioned here in the first 8-10 years I've been here, and in the past year and a half, these are kind of tip our tongue daily or every other day discussions. And to have this program where the CV surgeon, the vascular surgeon, the cardiologists are under the same house, the same roof, in the same clinic, and where we participate in the pre-planning, the hospital course, the cardiac rehab we have here. I think they've all been tremendous, and they make it eager for us to come in and work every day. So looking forward for more to come, but I thank everybody for their efforts.
Thank you, Dr. Ng. And for those who don't know, Dr. Ramfording is our medical director of the cardiovascular service line here at ValleyCare. He's been a great leader and a great partner to me, as well as the other surgeons and colleagues. So thank you, Ramford, for your leadership as well throughout this past year. Just to share, our patient, Gary, asked a great question. He wanted to know what AAU meant. So thank you, Dr. Speck, for explaining it to him. It is acuity adaptable unit, and it allows for the flexibility that we have in the type of nursing from one bed to the other. So, so hopefully, Gary, that answered your question. Any other questions or comments from any of our attendees this evening, or from any other panelists as well?
This is Monica. Good afternoon, good evening, everybody. Chief Nursing Officer here at ValleyCare. I want to echo everybody's comments around how excited we are in having this cardiac program, surgery. Definitely is a time to celebrate all the wonderful things that we've been doing with this program. But I think, it also gives us an opportunity. There's always an opportunity for us to improve and continue to grow. So I do want to, let you know from nursing that we are very excited to collaborate and to partner with Dr. Longoria and Dr. Currie on how we can grow and elevate definitely our nursing practice and support the care of our patients. So thank you.
Thank you, Monica. I don't see any other questions here. I know we all, as Rick mentioned earlier, we do have some nice cupcakes and beverages in the other room with hopefully the staff there enjoying that. And I know our panelists will be able to mingle with them in a few minutes. Any other closing comments from anybody on the line?
What, yeah, something. I think, Mina, I don't know if you hear us or not. You hear us there?
We can hear you.
Yeah, so I'm sure this is being recorded. And unfortunately, this is a town hall meeting, and I think the town is working. And so one of the things, if this is going to get recorded, I just want to tell everyone that I applaud what we've done here, and I'm just looking forward to it growing and continuing on. But everyone, I had the privilege. I'm going to say a brief thing. I had the privilege of operating on Pete Currie, Coach Currie. Everyone knew him as Coach. He is the Princeton offense, for those of you who know anything about basketball, when he was a coach at the Kings, the Sacramento Kings. And the thing that he always told me was, it's not what you do, but the people who do it that matters. And I want that to go to everyone at this hospital. And that's been my experience so far, is that we deliver healthcare, and anyone can do it almost. But it's the way that we do it. It's the way that the people that we have here, the dedication of how we do it, that makes all the difference in the world. And I think that's one of the things that that comes from the top down with regard to Stanford Health Care. And that's the thing that I've been most impressed with in joining this team and having the privilege of joining this team, is that message comes from the top down. And it doesn't matter what you're doing, but how you do it that makes all the difference in the world of these patients. And I just want to thank everyone and applaud you for all of your efforts. So,
thank you. Well, if I don't see any other questions, that's a great note to end on. Are there any other questions or comments from the group?
We do have a question in here, or a comment.
Tina always has a comment, but I just want to say this was a great opportunity to kind of see the full picture of what we have accomplished and where we're going with the full picture is. It's nice to see you here, Gary, one more time. Sincerely, my name is Tina. I'm the director of inpatient adult nursing. I now have the ICU and med-surg unit. And really for us, on the nursing side, being able to be a part of, I wasn't there in your care, but there were many others that were. And we were so glad to hear that you're doing really well. And it inspires us to learn more, do better, so we can help others in the same situations that you've been in. And thank you for being here. And I'm really excited. And I know we have some staff here in the room who have been in the ICU. We've got operating room. We've got a variety of people here, including the new nurses and med surgeons who are training to learn more about cardiac surgery and to take care of patients in what we're calling that AAU, which really means that now when patients have surgery in the ICU, they'll spend their time there and they will step down outside of the ICU, continue their intermediate level of care, and then their medical surgical care in one unit and be able to discharge from there. So it'll be a great opportunity for patients to really feel like they're actually moving somewhere, like moving one level out, and then home. So it's going to be a really good process, I think, within the hospital, and that's better to serve our patients who will have more comfort as well during that process. So thank you, everybody, and the whole team that's been involved. This has been a journey, and we're excited for the future.
Thank you.
Thank you.
So can I just comment, we had to move into this room, our screen just went up, it was like a drop the mic moment. Sorry, we needed to come in here. Can I just ask a couple people, David Speck, would you make a couple of comments? And I have some other people I'm going to put on the spot, but so be prepared.
I'd be very happy to. So it's been a pleasure working with all the team. Again, they're very engaged in making sure that the best quality care is being provided. And as Dr. Wu was mentioning, we really look forward to the future and advancing the whole mission of Stanford. So in research and education, as well as excellence in clinical care. And luckily with the team that's forming, I think we're going to be very successful in advancing that whole Stanford mission. So thank you very much, team.
Thanks, David. Tracy?
I'd love to say that David stole my words.
Your little feedback there.
All right, I'm going to try that again. Is that better? Yes. Yeah. All right. So I think David said it really eloquently, but I couldn't agree more. I've been with the organization now 4 years, so certainly not as long as you, Dr. Ng, but this certainly represents a really exciting time for Stanford Health Care ValleyCare. Not only our partnership and collaboration and continued alignment with Stanford, but certainly the way that we are building programs in a way that elevates the care that is offered to our community, I think is really exceptional. Dr. Longoria, I was there that first day that you came through the organization. You talked a little bit about that feeling that you got from meeting many of our team members, and I really appreciate that. I think the culture that we have in the organization is really special, but I do want to share with you that we felt the same way having you walk into our building. You were incredibly engaging, and I think that has started this relationship off in a really well-developed and meaningful way, and something that really translates pretty exceptionally throughout the organization, whether it's physician to physician relationships, the relationships that you have with our teams, and certainly the ability to collaborate and provide high quality, high reliable care at the bedside. So I am absolutely just so excited and thrilled about this particular program, and really looking forward to that 200th and 300th patient and more to come. So congratulations to everyone.
And then two more that I can see on the screen, and then again, anybody else who would like to say anything, but Ryan and Kyle, if you wouldn't mind saying a couple of words.
Thanks, Rick.
Go ahead, Kyle.
Can you hear me?
Yeah.
Okay. So, we got to spend a little time, do our strategic plan last year, and we had participation from Stanford and from the local community and from all of ValleyCare leadership. And the biggest thing that we wanted to do was expand the clinical care that we provided to Tri-Valley members in the Tri-Valley. And so this is a critical part of that. This is services that people would have had to leave this area to go over to Palo Alto to get this care. And so it's a tremendous part of what we're trying to do is make sure that people don't have to drive too far to get critical care that they need for the community. So I'm ecstatic to be part of the celebration as we expand these services.
And I've got Ryan here.
Sorry, my mute isn't working. I wrote down, can you guys hear me okay now?
Yeah.
Thumbs up. I wrote down 2 words as this was all playing out. You guys can see that? No. It must be my handwriting. So it says caring and ambitious. If there are 2 words that I would use to describe the team here, it's that. You have an incredibly caring team. And I'm not just talking about the patients, I'm talking about our team. Dr. Longoria, Dr. Currie, I can't even tell you guys how much they boost you up, and they speak about the clinical team that support them. It's unbelievable, it's constant. So caring about the team that supports them and about their patients, but ambitious as can be. They are so happy with where we've taken this program, but I will tell you right now, they want to take it 10 notches up. So I can appreciate that so much. I've worked with a number of cardiac surgeons over the course of my career, and I can honestly say I've never met a duo that is as caring and ambitious as the duo that we have here. So thank you for all that you've done. Thank you for bringing us to where we are today, and for ultimately where you will take us down the road. Appreciate it.
So, I'll just Mino, unless there are other items on the agenda, I think we'll just close it up by just saying again, thank you. I'm actually glad that we got to come into this room and see the people that we keep talking about. So we are just absolutely thrilled, and I'll just keep using the word grateful for the amazing opportunity that this has been to be a part of this. But again, the future is exceptionally bright. We're at the right place at the right time with the right people. It's going to be a fun ride. So looking forward to it. Anything else, Mino?
No, that's it. You've all said it best. And I again, thank you, everybody. Thank you, Gary, our patient, for sharing his story today. To all of our speakers, to all the staff, and to all of our attendees this evening, thank you so much for partaking in this wonderful celebration. I wish it was different without COVID. We will get there. I know we will. So keep your heads up. Keep doing what you're doing. Thank you, and have a wonderful evening.
Thank you.